Despite President Obama's repeated promises that Americans could keep their health insurance, a new report says 52 million people could lose their plans. And as Caitlin Burke reports, others are finding out that their insurance costs are skyrocketing.
For millions of Americans, the reality of Obamacare is hitting home in the form of a letter. Those letters look something like this, informing them that they're losing their current insurance coverage because it doesn't comply with the new health law. And that means some people are finding themselves with new, much more expensive insurance plans.
I called them and I said, this must be a mistake. I got this letter that said my premiums are doubling. What's going on here? And the woman told me that I was considered medically underinsured with my previous plan.
Experts say that policy advisors on both sides of the aisle, including those in the White House, knew this would happen before Obamacare was even signed into law.
It's an outcome that's built into the design of the bill. I mean, if you're going to require that everyone has to have health insurance, then you have to define what is health insurance. And if you define what is health insurance, some people's insurance that they currently have isn't going to meet that definition.
Kathy Cairo is one of those people. She's a realtor in Columbus, Ohio, and she says her individual health care plan was exchanged for enhanced coverage. But it's not just her family that her new coverage takes care of.
The first thing she said to me was, you now have coverage, dental and vision coverage for all children under the age of 12. So I raised my hand and I said, okay, stop right there. I have no children under the age of 12. I said, so take that off my plan. And she said, we can't do that. She said, Obamacare mandates that under this enhanced coverage that you now cover every child under the age of 12. And I said, well, ma'am, could you do me a favor? Could you give me all of their names? Because I would like to go to them and ask them, since I'm putting braces and glasses on your children, would you kindly contribute to my children's college education? Because I will now struggle to pay that.
In many cases, enrolling in Obamacare means higher monthly premiums, but also higher deductibles, making medical care at hospitals like this one nearly impossible to afford.
I will probably, hopefully, never need my insurance because I'll never meet that deductible. I have to pay up to $5,000. I still have a 20% copay. It is really catastrophic insurance and paying for other people's kids.
And it wasn't just her deductible that went up. Her premium increased from just under $800 a month to nearly $1,400.
There's going to be winners and losers. The big thing is that most people are going to end up paying more than they are today.
But Cairo says the government has no right to decide those winners and losers, including herself.
How dare you in Washington tell me that because of my hard work, I now should not only be responsible for my children, but I have to pay for somebody else who has not had the work ethic that I have, who has not made it work every day, who has spent their money unwisely, who has gotten up every day relying on somebody else. How dare you tell me that my health plan is not sufficient?
Caitlin Burke, CBN News, Columbus, Ohio.